Well, I'm Dr. Prather. I'm a chiropractor, licensed chiropractor, also a licensed acupuncturist. I also have a diploma in American Board of Chiropractic Interns. It's a 3-year postgraduate program where we really get into the diagnostics. One of the things as I graduated from chiropractic college, I really wanted to learn beyond what was given to me on that. Very good basic education, but really felt that there was much more that was needed. So I interned with what I consider the top 6 chiropractors in the world, learned from them, and then also I learned about diagnostics, because if you don't know what's wrong with someone, it's very hard to fix them. So the knowledge, the first thing that we really want to do every time that we have a patient come in, the first thing that we're really looking for is, well, how can we really help the patient? Really understand the patient, what their needs are, what they're looking for is the first aspect of any type of care. The second thing is you actually need to know exactly what's going on. So we don't like to guess, we like to know, and once we know, it makes it a whole lot easier to fix someone. And it's amazing how many people that I have coming in that they've just been guessed, on what's going on, what is the problem. Here, try this, see if that works, and if it doesn't, let's go on to something else. I don't like that idea. I want to know before I start any treatment what is actually wrong with the patient, and it makes a world of difference on the results. One of the problems that we have right now is we have a crisis. Now, nobody really cares if I think that there's a crisis, but the top authorities say that we have a crisis in pain. Not only do we have a lot of people in pain, which is one crisis, and then they tried to come up with a solution to that, and that solution actually created a whole nother crisis, which is devastating to our communities. The Center of Disease Control, the federal government, the president had a whole conference on this whole situation with not my words, but the federal government's and the Center of Disease Control, FDA. Everybody says that that this is a disaster, is basically what's happened. And we have the answers. Even the medical community, all the authorities have said, yes, this is really the way to go. The whole problem now is getting this out as a message, and I'm trying to do my part on getting this message out and really talk about what the alternatives are and what can be done. And so I'm very glad that you came. We've been putting out radio programs, we're having lectures on it. We're trying to communicate with other doctors and do our part on educating on what the answers are. Get addicted to natural pain relief is what we're looking at. Pain is a huge problem. Centers of Disease Control talks about their statistics, 2012, they always do those. 17% of adults in the last 3 months from when they had done the survey had severe migraines or headaches. So, big problem. 15% of adults had experienced pain in the neck area. 29% of adults in the last 3 months from when they had done that had said that they had low back pain. And 5% of adults had experienced jaw pain. These were statistics that were presented back in the early days, and they said, well, this is unacceptable, the amount of pain that people are going through. So, we need to find an answer. And what they felt was that answer was narcotics. Very important type of way of doing it. They had done some very poorly done studies where they had put out an article where only 2% of the people actually become addicted to opiates. Absolutely false. Go ahead and hit the next one. You can just stay right up there. Okay, from 2000 to 2014, 500,000 people have died from prescription opiates. Okay? Come right on in, have a seat. So we've had 500,000 people actually die from opiates from 2000 to 2014. And the interesting thing is those were properly prescribed. They did not consider the people who didn't take them properly. These were people who had been said, here, from your doctor, fill this prescription, this is how many you take. And they took them exactly as they were told to. Okay? So 500,000 people died from something that their doctor had given. The US consumes 80% of the world's pain prescriptions, but we're only 5% of the population. Something's wrong. There are 238 million prescriptions written every year in the United States. That's almost enough for every man, woman, and child to actually take a prescription. And then 1 out of 4 people with long-term opiate therapy struggle with addiction. Just stand right there. That's better. Okay. So, the big problem with this is that opiates have been proven for chronic pain not to work. They've done the recent studies. For acute pain, opiates actually work. For chronic pain, long-term type of pain, they don't work. They actually make the problem worse. So if you were taking pain medications for opiates, what happens is it actually destroys your own body's ability to handle pain. So they've done studies on year after year, people who are taking opiates. Some people have been on them for 20 years. We had a lady who came in here, had been on very high dosages of opiates for 16 years. What they find is as you are on chronic type of opiate type of medications, your pain level raises. So if you had never taken an opiate, and in 5 years, if you measured your pain level, it would be less than what you had been with opiates. So one of the problems is even after that, what we find if people have been on opiate medications, and these are very common types of things, hydrocodone, oxycodone, not even considering that the really, really heavy types of opiates, then your ability to actually, even after you fix the problem, people are in pain because of the opiates. So if I took someone who didn't have pain, put them on opiates for a long period of time, their ability to actually sense pain increases, so that they would actually have a pain problem. So not only was this not fixing the problem, but it's actually making the problem worse. It's a horrible type of treatment. Opiates are great if you are dying, or if you're on something, have cancer for a short period of time. Things like that. Short times, it's absolutely fantastic. Acute kind of conditions, great. Take the milk of the poppy. But any time that you're talking about any type of opiate prescription over 3 months, it makes the problem worse. And you saw how many people are actually taking it. So this is totally horrible type of a prescription type of pattern that we've started to develop here in the United States.